Okay, I think we'll go ahead and get started. There are 3 handouts that have been distributed around, and so make sure you each get a copy of those 3. The 3 handouts, one of it's entitled something like Fiscal Considerations and Family First, and there's on one side, it has the first page, and if you turn it over cleverly, there's a page 2 on the reverse side. Then there are 2 pages, pages 36 and 37 from the Ways and Means Committee report that I will reference as I talk. And those have some kind of dark yellow highlighting on it. And then there's a copy of a provision of the Social Security Act related to kinship navigator requirements that are in the Act. So those are for you to have. As has been said earlier, the presentation that I'm going to go through pretty quickly, since Cheryl always cuts my time out, but I always plan for that. So we'll be okay. But I'm going to go through it pretty quickly, but the slides will be available to you at a resource site that is going to be available to all the participants. Other than the cover slide, there's 12 slides in there, so it's not like 73 slide PowerPoint presentation. So we'll have time for some discussion and all as we go through. Now, this was designed as a fiscal considerations presentation primarily for states, and I do want to find out which states are here. If you are from a tribe, you're welcome too. But for a second, there's going to be another kind of companion fiscal considerations presentation in the next breakout series, and Don Schmidt is going to be presenting there, and we've shared our material with each other, so hopefully it'll be like we planned it. And I've got 2 questions for Don Schmidt that I didn't tell him about, and I'm going to plant those questions with you as we go so that he can deal with those in the next session, and I won't have to. Okay? But he knows if you've worked with Don Schmidt, you know that he has encyclopedic knowledge of all of this stuff. So I'm going to try to highlight what some of the requirements in Family First are, and then hopefully get Don's help also if there are ways around some of them, because that's also part of being an expert. Okay? So shout, what states are represented here? What states are from over here? Yeah? Oregon, okay. Alaska, okay. Washington. Remind me, there's one unique thing about Alaska that we need to talk about as we go, but we'll come to that. Okay, Washington. North Dakota, okay. Arizona, okay. Thank you. Montana, right? New Mexico, Iowa, Alaska, okay. Alaska, okay. So. And Alaska, and I think North Dakota, there's something we need to say about North Dakota also as we go through this. So fiscal considerations and family first. Some key points that I want to highlight. First of all, this is about a session about fiscal considerations, which involves money, but that's not where you start, okay? Always start with your vision and your goals. What is your vision for children that you serve? What is your vision for families that you serve? What are your goals in serving those children and families? If you focus first on the money, it's like you fill up the gas tank but don't know where you're going, and so you just drive around, okay? Money is important because without the fuel in the tank, ultimately you don't get to your destination. But you got to set your GPS first, and your vision and your goals are the place to start. And that's something that, as you plan for Family First, is worthy of some real continued discussion as what are we trying to accomplish there. Okay? Secondly, what are your key lessons learned? Some of you are from states that have been involved in 4E demonstration waivers. What have you learned from that? Some of you are from states that haven't been involved in waivers but have done many other innovative things in your states in terms of child welfare practice reform. What have you learned? What do you want to build on as you move towards Family First? What's your fiscal pathway from now until October 1st, 2019, which is the date when some of the major new provisions, not all, some are sooner, but how are you going to get from here to there? And how will Family First impact, particularly when you get to 2019? And what changes can you make now to improve your readiness for Family First? Do not wait. This time between now and October of this year and then October of next year and beyond is precious time in terms of preparation, and be sure to take advantage of that. I'm going to talk about 5 impact areas for Family First. I'm going to start with the congregate care provisions. A lot of times people start with the prevention services because that comes first in the Family First law. I'm going to start with the congregate care provisions and a couple of things about that. Then talk a little bit about the prevention services provisions. Then some new opportunities that are prior to October 1, 2019. Some key decisions to make, and then some important questions to consider. Starting with the congregate care provisions. Now, if you read the Social Security Act, which I know everyone has, you would come away from reading that thinking there is basically 2 kinds of settings under 4E. You've got foster family homes and you've got child care institutions. And then it goes into more details, but we talk about that child care institution side, that congregate care side, often as if it's one thing. So one point I want to make is it's not one thing. It's a range of things, and you have some congregate care settings that are more family-like, and by more family-like, I mean smaller size, I mean no shift care, so there's continuity of caregiver relationships, et cetera. And then you have some that are intensive residential services by varying descriptions, and you have a lot of kind of gradations in the middle. A lot of people that I've talked to who read Family First start here and say, how can I make all my congregate care facilities QRTPs, Qualified Residential Treatment Programs? Let me suggest to you that's not the place to start. There's a lot, depending on jurisdiction, there's a lot happening in the more family-like environment that are never going to meet the QRTP requirements, and you probably don't want them to. Okay, so the first challenge is going to be, what do I do about this capacity, and how can I reprogram that capacity to meet my needs? Now, point 1 is, if you can reduce entries into out-of-home care, and if you can increase exits from out-of-home care without compromising safety, then the stress on your system is going to be less than if you don't do those things. So you want to start with that, looking at your overall system. Some jurisdictions, some places, have said, wait a minute, I've got small group homes with foster parents in them that I have classified as congregate cared in the past. Maybe I need to rethink that and say, could they be licensed as family homes? Some jurisdictions I've talked to have said, well, I don't think that's going to work, but maybe I can work with my provider communities, take that capacity that we're going to lose, reprogram it to be foster family homes, okay? What is going to work in your jurisdiction is going to depend on your uniqueness, but my suggestion is that's a place to start and to say, how can I take this capacity and make it more family home-like? And do I really want to try to turn everything into a QRTP? Because QRTPs are for a very special purpose. And some children need that level of care, but a lot don't. The other thing to think about in here is there are other settings that are permissible other than QRTPs, one of which are children who are either victims of sex trafficking or are at risk of becoming victims of sex trafficking that are getting high qualified specialized treatment. That's an area where there's a lot more that could be done in many places, and one to take a look at, okay? So on your handout that's entitled Fiscal Considerations, are some of those questions that you'll want to ask yourself as you go through. I've tried to do 5 questions in each of them, but as you do your planning, those are some specific questions to ask yourself about that capacity. Once you go through the other things, then deal with the QRTP provisions, okay? Now I'm going to shift focus over to the other side, over to the family side. You know, it's hard to find little cutesy clip art that really captures all the variety of families that we have. So these are not intended to do that, but just as there are many different types of congregate care, there are many types of families in family situations. But here I want to break the world down into a couple of areas. First of all, we know that for in-home children who are at imminent risk of entry into foster care may be candidates, okay? When we look in foster family homes, though, there's a dilemma. And this is a dilemma that Commissioner Milner and his staff are going to face. And as you provide input, which he keeps asking for, see if you can help him resolve this dilemma, okay? And if you look on the page that is got the highlights on it, page 36, this is from a 2016 report by the Committee on Ways and Means from the committee report on the passage of the 2016 version of the Family First Prevention Services Act. And the committee staff have said that because many of those provisions found their way verbatim or near verbatim into the 2018, is that this gives good insight into what they intended. There's a lot of language about kinship care providers and children being eligible for prevention services if there are kinship care and kinship placements. And there's language you can see over on 37 there about formal and informal kinship care placements, etc. The second bullet in the middle there is eligible for prevention services. Here's the dilemma, though. Under current law that doesn't change under Family First, if a child is under the placement and care of the state agency or local agency administering the program, that child is by definition in foster care. Whether or not that child is in licensed or unlicensed care, paid or unpaid, the child is in foster care. Question: how can a child be at imminent risk of entry into foster care if the child is by definition in foster care. That's a dilemma that Commissioner Milner and his staff will face. My own view is if you read the congressional intent and read the law with a little bit of creativity, you could read that to mean that if a child's of imminent risk of entry or re-entry into foster care beyond a relative setting, or you could read it to mean that many relative settings that are under the placement and care of an agency are not eligible for prevention services. So that's one that's going to be one of these interpretive things that we'll all have to see how that comes out. But in your jurisdiction, you're really going to want to look very closely at what constitutes placement and care and whether or not children who are in kinship settings are under the placement and care of the agency. That's a key. I have talked to multiple jurisdictions, and in some cases the answer is yes, they are under placement and care, and in a couple of cases it's no. There are types of legal placements that are not. So that's an important one to highlight. The other thing is that if you lose capacity over here in terms of what is going to be federally funded, you're going to have to increase capacity over here, okay? And regardless of how the candidacy thing works out, your ability to recruit and retain foster family homes is going to be even more critical. And the extent to which they can meet the needs of children who need therapeutic environments, whether that's through a therapeutic foster home, whether that's through wraparound services or support services, a lot of different ways. But that's going to be an important part of the challenge going forward. Now I want to talk about this prevention services a little bit more. Mentioned about candidacy, and the door to prevention services goes through candidacy. This is why it's critically important. And when you look at a candidate who is eligible for prevention services under the law, you see interesting stuff. We know that prevention services includes mental health and substance abuse prevention and treatment services. Pretty straightforward. The language in the law is in-home parent skill-based programs, and 3 examples are given there, although they're not exhaustive. But if you look on page 36 of this committee report, look down at the bottom at the right above the highlighted section, gives some examples from waiver states and things that waiver states did at interventions, and goes on and look in there, third bullet, practices that facilitate greater parent and family member input in case planning and management through the use of family group decision-making, family team conferencing, and other family engagement strategies. I confess to you that when I read these words, I didn't think about family engagement strategies as meeting this, and didn't think about family team conferencing or whatever. But when I read that committee report from 2016, that's apparently what was in the mind of the members of Congress that passed that bill. So how far this goes is, again, one of those questions. And as you comment on the request for comment that's gone out about the evidence-based programs, that might be something that you might want to highlight as an area, because one of the things in that guidance that they say is they'll give priority to these services that are offered in-home. And they say nowhere in the guidance that I've been able to see any priority that things that were highlighted as prevention services from the experience of waiver states. So at least as I submit my comments as a citizen, which I intend to do, that's something that I'm going to highlight in terms of that, because it's going to be an important consideration. Okay, we know that the prevention services are for not more than 12 months. Although guidance does indicate that you may be providing them for more than 12 months, you're just not going to get federal reimbursement. And as was mentioned in the previous panel, you know, funding for 12 months is better than not. So that's something to deal with. These are for children who are candidates. And there's also one other group, children in foster care who are pregnant or parenting are eligible for these services. And the services have to be trauma-informed and provided in accordance with promising, supported, or well-supported practices. Important to look at here, and this is where those of you, how many people have as part of your job responsibilities, responsibility for fiscal issues, fiscal reporting, revenue management, any of those kinds of things? See, be proud that you have to do that, okay? No, not like that, you know, yes. One of the reasons that your fiscal people are critically important and also deserving of your love and your sympathy is they got to deal with a question that's going to come up, which candidacy funding under Family First is for candidates who meet all these requirements. And when we get to talking about, in just a minute, maintenance of effort, then is it subject to all these qualifiers? And what about children who are at imminent risk of removal, who are candidates under current law, but who are not getting one of these prevention services? Then do we have, under the law, two classes of candidates or one class of candidates? Do we have some that are subject to penetration rate, cost allocation, and some that are not? This is why your fiscal people are going to seem a little bit crazy for the next few months as they figure that one out, okay? And, of course, this is still in the process of becoming, so that's going to be an important part of your planning efforts. So we've reached the part in the presentation that I like to call pop quiz. Suppose, yeah, Claire knows the answer. So here's the question. Suppose you have prevention services claims, and I'm talking about total computable dollars, that is the federal and the non-federal share, whether that's state and local, and you claim $10 million total on activities that are promising practices, $10 million on supported practices, and $10 million on well-supported practices for a total of 30. In terms of federal reimbursement, how much will you receive? Just contemplate a moment. Everybody come up with your answer. Got your answer? How many people say A? No. How many people say B? No. Oh, nobody willing to commit. How many people say C? Okay. You claim 30 and it's 50-50 federal, so you get 15. And how many people say D? Okay, so Don said D because he's going to figure out a way to get around it. In terms of the federal share, the correct answer, Claire, is B. Yes. Okay, because your federal reimbursement 50% must be on well-supported practices. So even though you claim 30, and normally 50% of 30 would be 15, but because 10 million was for well-supported, 5 million of that is federal, and that has to constitute 50%. So you can get 5 times 2 or 10 million. So in this example, it would end up with 30 million expenditures, 20 million state or local, 10 million federal reimbursement, okay? So what does that mean? That means that you've got a real financial stake in what gets defined as well supported, and moving towards activities that are well supported, because in addition to being things that are important to do programmatically, it's going to be a potential limiter on the amount of federal funds that you can get. Okay, I mentioned the criticality, and boy, I'm always reluctant to show this chart because people may disagree with the next chart, and I want to make clear about the next chart that I'm going to show you is the criteria that went into the chart are ones that I made up. I just arbitrarily and capriciously made them up because I used to work not only for state government, I used to work for the federal government too, and I learned you can do that. So, but if you have a different sense of your state on the next chart and you want me to change it, you just let me know, and so I'll be guided by your assessment of this. But if candidacy is the door through which prevention services are going to be funded, then past experience with candidacy is something you ought to think about. So here's my assessment. I've color-coded every state, and with the following. Historically, if you have done little or no candidacy claiming in the past, then bright red. If some candidacy claiming in the past but less than average, then dark red. Candidacy claiming in the past above average, dark blue, and substantial claiming in candidacy, bright blue. Now, a couple of things to be clear about. Number one, this blue and red thing, there is absolutely no political implications of that, okay? I tried red and green, and it looked just too Christmassy for July. And so, so I went back to the blue and red, but no political implications there. Although it is kind of funny to see some of the blue states here, but we'll, you know. Now the way I did this, I looked at your past claiming, and the latest figures that I had available was federal fiscal year 2016 for non-waiver states. Waiver states, the way you report and the way the federal government rolls it up, it's hard to tell. So in some cases, I had to go back pre-waiver, and I looked at fiscal year 2012. So some of you may have changed your practices last year or whatever and do more candidacy claiming, but maybe not. So, but let's see if folks here, Montana, I had you down for not so much in the candidacy claiming. Is that okay? And New Mexico, above average in terms of candidacy claiming. Who else is here? Oregon? Yeah, Oregon. Yeah, you know, not bright blue, but and the way I made this assessment, I looked in the reports that I had. I looked at the dollar amount that you claimed for in-placement administration and the amount that you claimed for candidacy administration, and looked at the percentage of your total administration claimed by candidacy. The national average is about 8% of total. So if you were above 8%, then you got bright blue, or you got some shade of blue. If you were above 20%, you got bright blue. And that's sort of how I did that. Here's the key point of this. Successfully claiming candidacy, even though there's some definitional differences going forward, if you have good candidate claiming in the past, it probably is a function of having good automated capacity to claim that, and good definitional work with your judicial system to make sure you got the right kind of stuff in your judicial orders, and you have a good way of tracking that on a per child basis, okay? So if you've got good infrastructure capacity, then you're likely showing up as some shade of blue on here. If you're showing up as some shade of red here, then the question is, what's your capacity? What's your systemic capacity for identifying and tracking candidacy claiming? And if it is not there, then you got 456 days, I think, potentially to get it there. And that's not a small thing, particularly if you're talking about making changes to your automated systems. The states that I've worked with that are bright blue on here have automated capacity that makes it easier for caseworkers to identify the right things and makes it easier for judges and magistrates to include the right kinds of criteria and capture that in a way that is well documented. The other thing that, as I've talked with jurisdictions, some folks say, yeah, we used to do it, and then we quit because we got a big disallowance. So some folks here that are in red may have capacity, but they have very real and very well-founded fear. And the best way to overcome that fear is to make sure that your systems are solid, that you can document it, and that you can kind of self-audit to make sure that you're feeling good about your capacity before you get to 2019. Question about that? Anybody want to argue for changing the color of your state? You think? Okay. Well, okay. Okay.
That's a huge change in our SACWA system, our ORCA system, CEWA system, whatever it's called now. And that's concerning to me.
So what color would you give yourself?
Well, based on your numbers, I think it's the right color. I just think
okay.
There's a lot of work still to do, even though we do
okay.
better than that.
So I'm too forgiving in my you know what? That's okay. No, I understand. It's a good point. And I'll tell you, for example, my home state, I come from this state, and if you look in our SACWA system, we don't document candidacy at all. And just don't do it. And that's going to have to change. Okay, so I mentioned about maintenance of effort. So let's talk about maintenance of effort. Now, there was some discussion earlier about non-supplantation provisions and all of that. The key thing, I think, to worry about is there is some language about non-supplantation, but if you search Title 4B and Title 4E of the Social Security Act, you'll find 7 specific references to supplantation. Most of them are specific to things like caseworker visits and regional partnership grants and things. So I'm not as worried about the general non-supplantation language. Maybe I ought to be, but not so much. more the maintenance of effort is going to be the more difficult one to work on. And I'm not talking about this Mo. I'm talking about this Mo. I did a presentation for the Florida legislature one time on TANF maintenance of effort, and I titled it Larry Curley and Maintenance of Effort, a serious discussion of TANF maintenance of effort, parentheses, yuck, yuck, yuck. So it always makes me think of, about Mo when I talk about maintenance of effort. But not this Mo, but this. Now here's the way it works. There's something in Family First that they call the State Foster Care Expenditures for Prevention Services and Activities. Okay? Think of that as a bucket. Into that bucket, you pour TANF, 4B, SSBG, any other state programs but not 4E, any of those expenditures, whether state or federal, in those programs for prevention services and activities. Now, first thing to say is, remember when we talked about prevention services, I drew a box around all of those things for children who are candidates at imminent risk of entry or reentry into foster care for not more than 12 months, for evidence-based programs supported, well-supported or promising, and all of those. So as I read this is subject to those limitations. So it's not just any prevention service, but those prevention services under the conditions defined in the law. But once you've got that, then that goes in your prevention services state foster care expenditure bucket. The bucket does not include prevention expenditures from 4E, and it does not include specifically 4E waiver expenditures, okay? For most states, this is the amount that was spent in federal fiscal year 2014. The importance of that is once you have whatever goes into this bucket, then you can't get any more federal funds to match any of these expenditures, so you get the 50-50 match on anything beyond what's in the bucket, okay? So what's in the bucket is you don't get any more money for that. Above the bucket, you get. I say most states, there is an exception to that, and there's a small state exception, and if you are a small state, then you have the option of whether you apply that to federal fiscal 2014, 2015, or 2016. Okay? And a small state is defined as up to 200,000 children. So that would include District of Columbia, it's not here. Vermont, it's not here. Wyoming, anybody from Wyoming? I don't think we saw Wyoming here, nope. North Dakota. North Dakota in 2014 had 169,000 children. So you're a small state. And Alaska. Alaska had 187,000 children in 2014. So those states would meet the small state definition, and so you have the option to pick a later year, or you can pick 2014. One question that I have that I tried to find, and Don may know the answer to, is what about tribes that have direct 4E? Because we know for 4E waiver purposes, for example, Port Gamble was treated as a state. If a tribe receives a direct 4E grant, can they be considered, have that option? I could not find anything that answered that question. So that may be one that for Jerry or to take back to see is how should tribes with direct FOIA be treated. Okay, for tribes with agreements, then it's going to fall under whatever state you're a part of. Yeah. Mm-hmm.
Is what goes into that bucket only those prevention services as defined as families first?
Okay, the question. Yeah.
Well supported, promising.
Yeah, and I'm going to repeat that just because we're recording, I think, that the question was, do the expenditures for prevention services and activities include only those that are as defined in Family First, for example, promising, supported, well supported, etc.? I think the answer to that is yes. That's how I read the legislation, although I can tell you the official status of my observations is very shaky. But as I read it, that's the way I read it. Yeah.
Many states will be a very small, low amount.
Yes. Yes. Yes, question?
And building on that, then too, would it also then just apply to those prevention programs that are used for candidates?
Yes. Those evidence-based programs for children at imminent risk of entry into foster care for up to 12 months. Now, one of the challenges there, first of all, there are two kind of numbers in this world, okay? Numbers that you can prove are true, and numbers that nobody else can prove are not true. and this falls into category 2. Now, I know that you're all going to be diligent in answering that question, but there is no federal report or set of federal reports currently available that I've been able to find, not the Child Trend Survey, not the CFS 101, not the SSBG annual report, not the ACF 196 for TANF funds. All of those have different definitions that don't necessarily apply here. The only way that the Children's Bureau is going to be able to get that number for you is to ask you. And they're going to have to send out and say, here's the criteria, and then you're going to have to answer that. And I know you'll do that diligently, and I know you'll keep in mind that the smaller this bucket, the greater your claiming opportunities are going forward. Krista, do you?
I'm a ways away from the process for a little bit, but I do think the idea behind the accounting of investment forms and the waiver was an attempt to be able to track some of this stuff. So I don't know how, I know there were challenges with completing that form, but that was one at least formal mechanism for attempting to be able to track where these investments were happening across the system.
Yeah. Yeah, and Krista points out for waiver states, there's a new form that was called the Accounting of Investments form that states had to complete, and there are subcategories for prevention funds, but they are definitionally a little bit different from that. So, you know, right. Right. And I would certainly, if I were a waiver state filling out whatever request comes from the Children's Bureau, I would look at that form and see how I answered that question before. Yeah. Question here?
Yeah, so something she said that made me think about with our tribes. So in Oregon we have tribal agreements with several of them, 7 of our 9. And so when I'm thinking about the maintenance of effort piece, if we have tribes who are providing prevention services out of their state, their tribal funds, one, how does that fit in the bucket? And then 2, then just going to the next piece of, did the tribes, they were providing these prevention services without determining candidacy for foster care, would those also,
Right. And yeah, no, good question. One of the other questions that I would look to Don to maybe have an opinion about, I tried to look and couldn't find it. It's like the BIA funds. Where do they fit in here? I don't think they do. Right. Okay, so, yeah, so Don's feeling is no, that wouldn't count in here, wouldn't be trackable or auditable in the state system. Krista Thomas, former Children's Bureau guru, agrees. If Don Schmidt and Krista Thomas both agree, I'm considering it settled policy. Okay? I've never gone wrong with that.
Yeah, and that would also include tribes that are 638 status as well. Those would be auditable by
Okay.
even if they aren't under the BIA.
Okay. So probably not. And exactly what this any other state program means, I mean, the language is plain in the law. It makes that reference. But, and my best reading of it is this is just one number that applies to the state. So if there are, you know, if the state expenditure is made up of some under tribal agreements, some state, some this, some that, it rolls up into one number. And that's the number beyond which you have to have expenditures. And obviously the thing behind this is not to make life more complicated. The thing is that the federal government doesn't want to say, here is more federal money and give you permission to pull out state money and not use it to make life, things better. I mean, it's a good purpose, right? That it's to try to encourage new money into the system to expand prevention services. So quickly, a couple of things, new opportunities, with some discussion earlier about kinship navigator programs. One of the other handouts you have, there's reference in Family First to a now obsolete provision that used to apply to kinship navigator grants and what those kinship navigator services are. Here's the unfortunate thing is that Family First says you can get 50% funding for kinship navigator services consistent with those things that were formerly in the law, but are evidence-based. And as Commissioner Milner said earlier, it's not clear that any of those things are evidence-based. So that's something that the Children's Bureau is going to have to sort out. We know that children placed with a parent in a licensed residential family-based facility for substance abuse, that's a new provision, October 1st of this year. You can pay federal funds, uncapped federal entitlement at the FMAP rate for those children, for the maintenance costs for those children. I can tell you that there is a growing awareness of that issue in the substance abuse treatment community. And some of these parents are in facilities that may not be Medicaid eligible because of something called the IMD exclusion, Institutions for Mental Diseases. Some of them may be in facilities that are Medicaid eligible, but the maintenance cost for the child is not currently, so this is going to supplement and the maintenance cost. My hope is, because there's such a need, that this may be one of those things that encourages development of resources that are needed. There are a number of improvements to Chafee, now called the John H. Chafee Foster Care Program for Successful Transitions to Adulthood, okay, which is going to make it hard for whoever has to answer the phone in that office. And particularly there, some options if you have extended foster care to age 21, of now being able to extend Chafee to 23 for those youth. And a number of other changes to 4B, including changes to the regional partnership grants and some other important things. So key decisions, biggest decision is, are you going to implement congregate care restrictions effective October 1, 2019, or delay for up to 2 years? The Family First gives you the option to delay. However, if you delay, then you also are delaying your ability to claim prevention services funds, okay? So you can't do the one without the other. Here's the challenge, and particularly state folks in the room, you know this. I don't need to say it, but I will anyway. There are going to be potentially competing issues here. For example, suppose among tribes that there's much less use of congregate care, then it may be advantageous for tribes to implement sooner for the prevention services. But there may be other folks in the state that may be saying, no, 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 that's going to hurt us. Some states that are county operated, there are going to be county considerations that are going to be computing. My main thing here is this decision-making process. My encouragement is to have everybody who's got a stake in it at the table and to have a really good, honest, transparent discussion about the ins and outs. If this is going to disrupt your system, let me tell you that was the intent, okay? So that's just something to pay careful attention to. Then also look at, are there opportunities to reposition your child welfare funds to best align with your vision? The biggest problem with 4E today is it's not aligned. And this is an opportunity for alignment, which is a good thing. A lot of important questions. I won't go over these individually, but we've talked about a lot of them. And there are some questions that the Children's Bureau is going to put out guidance about potentially. As Commissioner Milner said this morning, the Children's Bureau put out a new program instruction on some state plan changes that adds to the body of work. However, a lot of these things, it's going to be like an old Polaroid picture that kind of slowly comes into focus. And if you wait for definitive answers, you will likely be too late. Okay? So some of these you're going to have to take your best guess and have the agility to change as you go if need be. So I'll conclude with something that I was on a conference call with some folks in a jurisdiction that were talking about the details of Family First, and as we went through the call, somebody described it as like the stages of grief. And so I came up with what I call the stages of FFPSA. Stage 1, delight that something finally passed. Stage 2, anxiety about all the requirements and the work that will be required. Stage 3, terror that prevention will be too limited and that use of group care will be impossible. Stage 4, cautious optimism that change is possible. And finally, stage 5, recognition that success requires building a system that truly maximizes prevention and family-based care, which is what we've wanted all along, okay? So you're going to find yourself at different places in that continuum or those stages as you go forward. But if you keep in mind where we want to get to, and as long as we can focus on that and figure out ways to make this work to help us get there, then I think we'll all be better off and better aligned, okay? So I think we're just about at time. Any last-minute questions? Okay, and anything that I've misstated or haven't emphasized enough, in the next breakout session, Don will take care of, okay? Okay, thanks.